powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
A very good morning once again. This is Issues at Hand here on Church of Uganda Family TV, powered by Protea Hotel by Marriott Entebbe. Comfort and luxury at its best. We are looking at noise pollution. Of course, when you go through the city, especially in the evening hours, it is all a mess. Sounds of different, some people are preaching, others are advertising their property, their services and goods, their businesses. So you realize it is a whole mess. And then before you know, cars hooting, and there is a lot when it gets to noise pollution. But this morning we want to look at the effects of noise pollution, because you realize this is a silent killer and we don't even know. Sometimes we think it is okay, or sometimes we take it for granted, yet it has an effect to our health. With us is Dr. Isaiah Kalinge, who is an ENT specialist. He's going to take us through today's discussion. It's a pleasure having you, Doctor, this morning.
Thank you so much for having me here.
We are delighted and we are excited to hear and to learn from you. Okay. Yeah, kindly greet our viewers as we get into our discussion.
All right. Our viewers, morning to everyone. My name is Dr. Kalinge Isaiah. I'm an ENT specialist. And I hope today you will learn a thing or two pertaining this problem that is present within our population, though unchecked, called noise-induced hearing loss. Thank you.
Doctor, maybe if we can start from your area of expertise. Some people don't know who an ENT specialist is and what they do and what their area of specialization is. Maybe if you can start by telling us what exactly an ENT doctor does.
Oh, okay.
Yes.
So essentially, an ENT doctor, although in the Western world popularly known as an otorhinolaryngologist, head and neck surgeon, is a doctor who has gotten specialty in managing and treating diseases that are involving our ability to smell, that's the nose, our ability to hear, that's the ear, our ability to swallow and form voices, and then also any associated neck or facial anomalies. It's a process for one to become an ENT specialist. It entails one first do the undergraduate training, which is essentially 5 years plus 1 year of internship. Then you can enroll in for a master's program, which usually lasts from 3 to 5 years, depending on the university. Yes. In brief, that's what an ENT specialist is.
Okay. Now, getting to our topic today. Sometimes I don't know whether we are addicted. You find someone walking with headsets or earphones in their ears. The music they're listening to is so loud, or some people are in a bar or a place of happening, and the music is so loud. Sometimes there is even a prominent saying that tumbi is a sound. In other words, you increase and increase. But we want to look at how this has an effect to our hearing.
Okay. Now, in our environment, precisely Uganda as a country, most of the people are in the urban centers like Kampala. We're exposed on a daily basis to quite a large amount of sound, which I would essentially call noise. From our workstations, on our ways to work, the ear is being subjected to a lot of sounds, a lot of noise. And over time, this causes wear within the systems within the ear, and that's as a result, individuals are prone to now getting associated reduced hearing abilities. It varies, and depending on the degree and also the duration within which somebody has had this exposure to these sounds. But essentially, common damage to our ears is due to the noise-induced hearing loss. It's mainly due to an inner ear malfunctionality as a result of continuous exposure to loud levels of noise. However, sometimes most of the people in the military, people in the police, and some factories, there are intermittent episodes whereby somebody can get a loud bang exposure. As a result, some of these individuals can also get these hearing loss problems due to the trauma. There is an acoustic trauma that is caused due to exposure of these high sounds onto the ear. In these individuals, usually they'll get their eardrums perforated because of these loud bursts, and sometimes there are bones within our middle ear that are responsible for transmission of these sounds, called the ossicles. If they get disrupted or dislocated, they can also develop hearing problems.
Okay.
Yes.
This is now interesting. So you talked about the hearing, the reduced hearing abilities, and I want us to derive more onto that because you say that when we are exposed to these sounds, so because there's no way you can run away from these sounds. At the end of the day, we get instructions through these sounds, through a phone call or through, we go to church, they preach using public address system. But at what level does someone get that wear and tear?
Okay. Now, there is several literature, and the susceptibility or the risk of developing this, let me say, ear injury or noise-induced hearing loss, it's a variant. It depends on the population that we are looking at, what race you are. Number two, how much of this noise are you being exposed to, and for how long? So it's not like a discrete factor that you can look out and say that at this level, if you're exposed to sound of this level, you're going to get noise-induced hearing loss. However, there are baselines whereby we look at sound levels of probably 80 dBAs and above. Individuals are prone to having now this problem manifesting.
What is dBA?
Okay.
Someone needs to know.
Sorry. Essentially, every sound we get, every sound that is produced, it's quantified. So dBA is a parametric tool we can use to assess and know the loudness and the intensity of a given sound signal. That's why sometimes you see KCCA coming over to closed bars. They do it basing on measurements of the noise levels. They use a machine, it's called a dosiometer. It measures essentially the amount of sound that is being produced in that area with its intensity. Then they can quantify and say this level is above the limit that is allowable within this area of residence or this commercial area. We need to close down this area. So essentially it's like a parametric tool we use for quantifying these sounds. That
so meaning a layman who doesn't have this tool cannot know that whether I'm past the 80 dBA all.
Yeah. Essentially, that is not very possible if you are to be objective. But however, subjectively, we always tell persons or patients we see in our clinics who have this problem, that one, if you ever get into an environment and you feel the sound there is uncomfortable for you, that's a marker for you to watch out for a likelihood of developing a problem with your ear due to the prolonged exposure of these sounds. So that's the vague parameter we tell the lay persons to consider. Once you go into a place and you feel probably you're over shouting or you're over straining to talk, to communicate to people next to you, you are feeling ear pain, and you're starting now to feel funny buzzing sounds within your ear, that's an indicator to tell you that probably you'll need to get away from that kind of environment.
And in our mind of naivety, you do this as a way of looking for solution. Is this of any help? If I do this as a way of trying to tolerate the sound.
Yeah. So essentially, that is kind of innately reflexive for us to respond that way. It's a mechanism for us to try to reduce the amount of sound signals that are reaching within our ear. So vaguely, yes, it can work, but ideally, if you're in an environment whereby these sound levels are going to be continuously high, it's advisable you get protective gear. Commonly, you've seen people at construction sites who get those big ear muffs, and then sometimes they get inserts which they fix within their ears. People operating heavy machinery, if you've been critical, people at construction sites, they tend to put on those. Those are all aimed at protecting your ear from these excessive sounds.
Now we have a problem, especially in a city like Kampala. You realize that sometimes you have no option For example, this is my workstation, or someone who is on the ground floor. That is where they're supposed to work from. But after 5 minutes, at least you'll see some van having a drive, and then you'll see this one preaching, then you'll see the other one advertising a concert, then the other time you see bodas recklessly hooting. So how can such a person then help out in such a situation?
Okay. Essentially, management of such a scenario, I wouldn't say it's more of a person-centered protocol that will be initiated. It will be more of a high-level, probably a policy to be documented in general for the public, to have these things laid out and rolled out, to tell individuals within our setting, precisely Kampala, all our environments, that they are meant to have specific noise levels that they are to produce, beyond which penalty should be there, all precautions should be taken to minimize these sounds. So at a larger scale, to a public health level, that's what we need to consider as a country, enact policies that can guide people who are in these work environments to have allowable or permissible levels of noise production. However, as we are getting to that level, it's advisable for individuals at a personal level to, one, if you're working in an environment whereby you are having long-term exposures of these noise-induced levels that are relatively high, you will need, one, to get personal protective gear, as I talked before. Then number two, it's also recommendable, if you can, to have an annual or a biannual review by an audiologist. Audiologists are essentially health personnel who try to assess an individual's hearing ability and the functionality of their ears. So it's recommended in the Western world, they do it as part of their protocol. Every year or twice a year, you have those annual reviews to make assessment of your hearing abilities. This helps capture early progression of this disease, all these issues, if they are starting to onset in individuals. So in our country, we don't commonly do that, though some corporate companies are now enacting this policy. They do annual reviews of their individuals or employees about their hearing abilities. It would be better if government enrolls this most of for individuals who are in work environments, precisely people working, let's say, in the telecom sector, people are on call centers, traffic police officers, people probably in metal fabrications and heavy industry that are entailing production of these high sounds, to have routine reviews of their hearing abilities and the functionality of their ears.
Okay. Yeah. Now, talking about hearing loss, we look at someone who has been subjected to this noise for quite some time. How long does it take them to now lose their hearing, and what is the process from the time they take in the sounds and what up to the time we now say that they have lost their hearing?
Yes. Even in the Western world, preferably, okay, for our setting in Uganda is where you would have probably best answered this, but we are way far from that. But in the Western world, even where studies have been done, there are no specific parameters in terms of time duration and amounts of noise levels that these individuals have been exposed to for them to get these hearing loss levels. But however, as I told you, these figures keep on varying, one, depending on an individual's genetics. The individuals by lineage, they are prone to having hearing losses, something that is inherent within them. So these individuals, they have a high likelihood of faster progression. Likewise, also, as you are aging, the older individuals within any population, they are prone to having faster progression of this noise-induced hearing loss. Then also individuals who are hypertensive, individuals who have cardiovascular diseases, individuals who are having associated therapies that could increase the likelihood of having this hearing loss progressing much faster, such as those on chemotherapeutic drugs, individuals who are taking certain antibiotics, most of the aminoglycosides, commonly you find people in pharmacies distributing out azithromycin on a daily, but it's a drug that needs to be used with caution because it can quickly progress this disease. And then also individuals who have been using the older anti-malaria treatments, the regimens that involved use of quinine. So you can't clearly quantify that this is the time duration and the noise levels that an individual is going to have for them to progress to have this disease. But there are factors that will keep on influencing the rate at which this issue is going to progress.
Okay.
Yeah.
You talked about a few risk factors, and that was my next question. Yeah. What other risk factors besides the medical factors you talked about lead to this challenge?
Okay. Number one, smoking.
Yeah.
Yes, smoking. Individuals who smoke, they have been noted to have a high risk of developing this noise-induced hearing loss. But however, importantly to note, Kampala is a town, they say, that doesn't sleep. People are always frequenting bars and concerts. You need to take caution because the likelihood of developing this noise-induced hearing loss is quite high in those individuals. The same applies for individuals who are commonly using these headphones or earphones for long durations. There is a very high likelihood of developing this noise-induced hearing loss as you grow older. Then also we've noted individuals in our setting, researches have been done for certain populations. Individuals who have been noted to work in environments with high noise levels. Commonly, in our setting, you find people who are in the welding areas, people in taxi parks, and the traffic officers. They have been documented in our setting, and there is even research to prove that they are prone to having these high levels of noise being exposed to them. So the hearing loss is much faster in such individuals. Yeah.
Days back, we used to think that such conditions come with age. Is that true that at some point even age can be a risk factor?
Yeah. True. Naturally, as you grow older, nerves keep on wearing out. That's within our ears, within our eyes. That's why you find older people, their visions tend to dim up. But age in itself, even without having this exposure to high levels of noise, it's a risk factor developing hearing loss. That's what we call presbyocusis. Now, when you have an added factor of noise exposure, the progressions are much faster for these individuals. So we've documented in literature that individuals under the same conditions, the younger population is at a lesser risk in comparison to the older population to developing this noise-induced hearing loss. Yes.
Okay. So, because this is really common that you find old people saying, I'm not hearing you well, so you have to either shout or get closer to them. But we have also seen young people, very young, 5 years, 6 years, suffering from the same. Is it in any way genetically related?
Okay. Now, essentially, hearing loss in general as a problem, it has vast number of causes. The causes are numerous and they vary. The likelihood of these events occurring vary from each cohort, let me say each age group. The causes of hearing loss in the young are different from those of the middle age, are different from those of the older age, and likewise also for the newborn. So you can't essentially tie to all the hearing loss that you see in any person to be due to noise-induced hearing loss. I don't know whether I create a clear picture for you. Yes. The causes are very varied. What could be the cause of the hearing loss in a child could be different. In most cases they're different, though they could also occur in the older age, but there is a very high disparity.
Are there any common causes we can talk about here, especially with the young ones, because this is increasingly becoming a thing for us here in our country, and someone out there would be really excited to know about some of these common causes?
Okay. Maybe I don't know what your cutoff point for young is, because young is a varied question, even in our setting.
Yes.
But I'm presuming young, you're looking at the youthful age.
Yes.
If you're looking at the youthful age, causes, commonly, noise. Noise, noise, noise. These are people who are always going to be finding in nightclubs, bars, concerts. They're listening to loud music. They're always on headphones, more so in our digital era.
The people telling you that DJ Tumbi is a sound.
Exactly, exactly. Yeah, so that's one of the biggest causes. Then number two, because the causes are still varied and there's still very many, the medications that we get. It's more common with people who self-medicate. It's always not advisable to self-medicate. You feel you're sick, you have something, you just go over the counter or you go to a pharmacy or the drug shop and you purchase that drug. It's not a good idea because some of these drugs have associated effects of inducing hearing loss in these individuals. Then number three, individuals who have recurrent or prolonged durations of coughs and flus, there is that likelihood of developing these hearing problems in the middle age. Then number four, our work environments. If you're working in a noise or an environment that will entail you to be exposed to loud noises, you are prone to having this. And it's an initiative as a person. Plan or do this every annual or biannual duration. Go for hearing assessment. The companies, some companies do pay for this, but some don't pay for this. But it's imperative that you do that for your own safety, because this can capture even this problem much earlier, and you can take on measures that can prevent its progression. Because once it onsets, usually the likelihood of reversing it is very minimal. It happens, but it's very minimal.
Well, this is actually a very big threat to the next generation, because if we have a generation that has hearing problems. So, Doctor, you talked about something that before we go for a break that I want to pick interest in. You said people who have prolonged coughs and flus. There are times you have flu and you feel your ears are blocked for a time being, or there are times you have cough, you cough and as if you hear something bursting in your ears. Is this what you're trying to mean?
That could be part of the issues, though they're also very minimal. But it's also a long topic of its own. We will get to discuss it if we get another time.
Okay.
Sometimes individuals develop what we call a station tube dysfunction, and sometimes disease can extend all infections from the back of the nose to the ear. There is a tube that connects the ear, precisely the middle ear, to the back of the nose. It's called the station tube. When you are usually okay and normal, sometimes when you yawn, you have a tendency of feeling your ears unblocked. It's because the station tube has opened. It's allowing air to go into your middle ear and fluids getting out. Now, when you have a cough or a flu, there is a likelihood of infection extending via that tube to the middle ear, or even just inflammation within that station tube because of extension of disease. It causes you to have that hazy feeling.
Wow. We are taking a short commercial break. When we return, we now want to know at what point do I now get worried to know that I'm losing my hearing. Stick with us as we come back.
Issues at hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
Issues at Hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.
Welcome back from that commercial break. Here we are discussing hearing loss, and the commonest cause of this is the noise pollution that a few of us pay attention to. And at one time we had policies that were being amended by KCCA, where they were requesting churches to soundproof the premises so that the noise, the sound inside is only consumed by the people inside. But now we have events that are outdoor. For example, this is something I witnessed. There was some gathering in Lubaga, and I was in Zambia, and I was following through everything clearly as if I was on ground. I now pity the people who were around there. Or there is a mechanism that the people around consume what they can consume, but because the speakers are raised up, they can even project at far places.
That's an issue. It's like a catch-22 because some of these events, or let me say churches and concerts,
we are yet to see political rallies as
yes. Even politics is coming on its way. They are not working in isolation. Yes, it may look like it's just that person organizing the event, but there is a political aspect towards it. So the way government or institutions work, they try to tread carefully because they have also interests in these events. But essentially, like what is done for the Western world, for whatever concert you're going to do, whatever event you're going to have, whatever church activity is going on, whatever rally is going on, prior environment assessment is done to ascertain these noise levels. KCCA or government per se has those equipment. They have no dosimeters. It's essential and imperative for them to do the prior testing of that environment, ascertain its viability or feasibility to attain humans present within it at specific sound levels. That's how essentially it's meant to be done, but it's a bit also costly for them. If they had to do this for every event, probably it may be so high on them and also the events organizers. So we are yet to get to that stage, but we presume with good political will, if a member of parliament comes up and drafts something around this, we can get these measures into our environment.
There is now another mess of the so-called sound disco, where probably the government might not even have a lot of input in it, where you have your headsets, you know how much sound you're taking in. You just see someone dancing.
I think that's a better option for the general public, though of course it will cause injury to the consumers, the direct consumers, but at least the scale of the effect is less. The ones who are not involved are not so much affected. Yes.
Now I look at all this, but at what level should someone know that now I should be having a problem? At what level? Are there anything like symptoms or signs or what are they called? They are called things that show that now you should be having a problem.
Okay. So essentially, to come to a conclusion of a diagnosis of noise-induced hearing loss, there are quite a number of things we look at. One, the history as clinicians, the examination findings, and then we do some tests. Now, you as an individual, you may not know all this knowledge, but as a person, watch out for some of these things. If you know you're working in an environment that will entail you being exposed to loud noises, watch out. Number one, if you start feeling ear pain, it's a concern for you. Number two, if your hearing ability, you're noting it to start reducing, the things that you would essentially hear back then, now you need to strain a lot. You need people to re-echo statements for you. That's a concern for you. That will prompt you to go for further workup to ascertain whether this problem is actually there or not. Then number 3, if you start feeling noises within your ear, a time comes whereby people will start, who are having this noise-induced hearing loss, they'll start experiencing certain sounds within their ears. Somebody tells you, I feel some funny sounds within my ear, like a cricket is ringing within my ear, like wind is blowing in my ear. And this is usually more marked in individuals we've seen. It's more pronounced when you get to a quiet environment or in the night when you're going to sleep. When everything around you is largely quiet, then you start feeling those funny sounds within your ears. Those are all pointers that could be indicating that probably you are starting to have noise-induced hearing loss. Though confirmation is essentially done in a clinic setting after review of a doctor, and then we do audiometric assessments to verify and confirm this problem.
We have another problem. For instance, someone has, maybe they feel like a blockage in their ear. So someone gets a lid of a pen, and then they start trying to clear the ear, or sometimes someone just gets their fingers and then you see them trying to clear. Or some other have gone ahead to advise for, no, when you have such a problem, you get water, splash it into the ear, then some have been advised to use oil, but in the first place, what causes that?
Okay, essentially, as I'd said, this is a very big topic. Things that can cause you to have hearing loss, that funny feeling of you're not hearing very well, you're feeling like your ear is blocked. There are very many. They are enormous. They are extremely many. So I would still recommend, as I tell my patients on a daily, have a review by a doctor. Have an ENT specialist review to ascertain what actually the problem is and how can they manage it. Because when you have that feeling, a problem can be within your ear. It causes you to have a reduced hearing ability, or that feeling of ear blockage. A problem within your brain can cause you to have that same feeling, because every signal we get on our body is finally processed within our brain to give us an articulate interpretation of what that is meaning, or a problem that is affecting the nerve that is picking signals, collecting them from the ear, taking them to the brain. So anything along that pathway, from the ear to the nerve to the brain, finally where interpretation is done, if you have a problem there, you can have a problem with your hearing. But even with the ear itself, lucky enough, it contributes to 90% of close to these cases. But even with the ear itself, it has 3 parts. It has the outer ear, the middle ear, and the inner ear. So even with it, a problem can be localized either to the outer ear, middle ear, or the inner ear. So the wax thing is commonly due to, it's largely an outer ear problem. When you have clogging of the wax within your outer ear, that's what most people presume is causing this blockage. But the list of things that can cause this hearing loss, even in the outer ear, is still long, is still progressing. You can't stick to that one thing. So taking self-precautionary measures, things you've heard from other videos, people's opinions, is essentially not a good idea.
Okay.
Yes, because in you trying to do what they're telling you to do, you don't know what the circumstances were and what the cause of their ear blockage was.
What about people who use objects like a pen lid or what? They use them as a way of trying to clear the wax.
To clear the ear. I always tell my patients that is very risky. It's good, but risky. So it's only good whereby you've confirmed from your knowledge that probably what is causing this blockage is the wax only. But it's very dangerous in scenarios whereby, one, if it's not the wax causing this problem, you're prone to damaging other parts within your ear. Essentially, the eardrum is most commonly at this risk. You can perforate it, and repairing or managing an eardrum perforation, it's a lengthy process and very costly. And then number 2, you trying to scratch within your ear, you will cause small wounds or lacerations within your ear. As a result, infection can easily get into your body. And once infection gets into your body, most of the bacteria, remember the ear is seated within the skull bone. Just above that bone is where the brain is. So there is a high likelihood that infection can easily extend from your ear to the brain. And that is also going to be another very big chapter for you. Very costly in terms of the money and even your quality of life.
Okay.
Yeah.
You say that when someone seeks medical attention when the problem is worse, nothing much can be done to restore the problem. We've seen innovations like cochlear implants and what. Can't this be an alternative solutions?
Okay.
We've also seen others having hearing aids that are not really cochlear implants, but they're having hearing aids that help them.
Yeah. So these are the implantable devices. They are devices sometimes we use on patients to enhance their hearing ability. There are very many. The list is very long. But when we use them, it depends on the circumstance around us using them. It's not like you just go to a shop and you buy. There is always an indication why you want to use that specific device, depending on the cause of the hearing loss this individual is having. Different causes and different degrees of hearing loss will ascertain or need us to get implantable hearing devices, but depending on the cause and the level that you're having. So essentially, mainly for the sensory neural hearing loss of mild to moderate levels, there's a way we quantify it medically. To moderately severe levels, we can use hearing aids if it's a sensory neural hearing loss. Sometimes, if we're having probably conductive hearing loss, we can use some implantable hearing devices, the bone-anchored hearing aids. But for certain levels of sensory neural hearing loss, commonly, we use cochlear implants. Now, these things are there in books, in literature, they are there online, you can read about them. But you getting to have them and maintaining them is a whole another thing. Good hearing aids may cost you around 4 to 7 million shillings. That is one hearing aid. So if you have, and you have a problem that is bilateral, both ears are involved, and you are going to look at 8 to 15 million to solve that problem. Now for the cochlear implants, it's a whole different chapter. That is something that can cost around 30,000 US dollars, just one ear implant. So if you have two, that's around $60,000. Putting it in our Ugandan terms to make sense for you, that is around 200 million.
Exactly.
So not very many people have that amount of money. So that's why it's good, as much as possible, work on the problem quick enough before it progresses. Yes.
Well, Doctor, I know we are almost getting closer to the end of this discussion, but what are some of the precautionary measures people can take, especially in maintaining their ear health quality?
Okay. If you're looking at ear health, there are basic things that you would look at as an individual if you're not probably in the medical field. Number one, anytime you get a cough, a flu, or any ear problem, promptly seek a doctor's review, preferably an ENT doctor. Then number two, always avoid noisy environments as much as you can. Number three, avoid self-medication, avoid self-medication, avoid self-medication. Whatever medications you are going to take, you need to have a consult of a doctor to ascertain for you whether the drug that you're going to take, in the dosage you're going to take it, for the duration you're going to take it, doesn't have an impact on your ear. Then number four, avoid touching inside the ears. Don't touch in the ears. Don't use earbuds. They are there on the market, but avoid using them. Don't use them, because the risks that you are posing yourself are more than what you're trying to relieve with the use of your earbuds. Then number six, if you have diabetes, cardiovascular diseases, hypertension. Do your routine reviews. If you have any of those associated systemic diseases, do prompt management of them, because this in the long run can also affect our ears if they're not handled very well. For individuals who are in noise environments, individuals that are in environments that entail them using their ears much often for long durations, always seek to do annual or biannual reviews from an ENT, and you do audiometric assessments to know how your ears are functioning at any one time.
Okay, that is really very, very important. So, what about are there gadgets that someone can use in substitute? I look at someone who is an editor. Most of the time, they have their earphones, or headsets, whatever they use as a supportive gadget. Are there any gadgets that you, as an ENT specialist, can recommend people to buy as a way of helping out themselves?
Okay. Now, the gadgets are very many, but starting with the basics, the personal protective equipment. One, earmuffs. Most of people are in those very loud environments. Construction, you are into mechanical industry, people are into welding, people down there in Chisenyi, they need some of these things. You can also get inserts, you can use them, but there are other better equipment if you have the money. There are certain earmuffs that they are more expensive than the conventional ones. They are programmed in a way that they have noise cancellers out, so the sound signals that you will be processing at any one time is going to be measured, quantified to be fit for your specific ear. And then also it will help cancel out the excess noises. So you're receiving a refined sound into your ear. These are present in the Western world, but they're a bit costly for us as a country because they will need routine maintenance and calibration to ascertain their functionality vis-a-vis your ear's ability to function.
Okay.
Yeah.
Thank you so much, Doctor, and thank you so much to you, our viewer. Unless, Doctor, there is anything we've left out you'd want to share in a minute or two?
I don't think there is that much that I'm to tell our viewers, but I'll still say ear diseases are highly prevalent in our situation. They are very easy and very quick to manage if you come to a hospital or for review by an ENT early enough. But however, they are very costly to manage when it's long overdue. So I'll still say, be cautious every time you get an ear problem. Seek a doctor's review, get an ENT specialist to review you so that this problem is managed prior early enough.
Thank you so much, Dr. Isaac, and thank you so much to you, our viewer. It's been a pleasure having you following through. Adrian Austin Mkalas is my name. I've worked with Mumza and Andrew, plus very many other people out there. And from the entire team, we wish you a blessed day.
Issues at Hand, powered by
Protea Hotel by Marriott Entebbe. Comfort and luxury at its best.